and welcome to another episode of HOC TV. Today joining me is Steven Sanchez, who's with our HOC Physical Therapy, Occupational Therapy division here. Tell us a little bit about yourself today, Steven.
I'm a physical therapist, and I did my undergraduate at the University of Texas and went on to physical therapy school at the University of Texas Health Science Center out of San Antonio. Graduated in 2007 and been doing therapy ever since. Got a pretty good sized background in both outpatient, home care, as well as even hospital setting. And our primary focus as of my last few years has been home care.
How did you get started in home care?
I got started in home care gradually. I started doing a little bit of work with HOC and spoke with Janetta, one of the owners of HOC, and she kind of breathed life into it, and we took off from there.
I guess some of our patients are wondering, what can they expect when they become part of the program?
Right, good. So each program is going to be generally customized a bit depending on what the patient needs. In home care, we're generally seeing the population 65 and older. And always one of our main goals is safety and function. One of the primary reasons people go to the hospital over the age of 65 are from falls. And that is one of the biggest things that is leading to comorbidities later on, as far as difficulty with ambulation, rehospitalizations and things like that. So our goal is to try to keep people out of the hospital, try to keep them safe and functional in their daily routine at their house, their activities of daily living.
Okay, and so what are some of the things that you do to help them with this?
Yeah. Good. So we go in, we're going to assess the home environment, and we're going to decide what are possible safety risks that we identify. Big one that we normally see is rugs on the floor, loose rugs, and people love their rugs, but we ask that they take them up or offer to take them up for them if they allow us, and try to educate them and the family, that they have good family support there, on what things may or may not pose a risk to that patient. After that, we do an evaluation, determine where the patient is needing some assistance, whether it be with strength, gait training, balance training, and things of that nature.
Okay, fantastic.
I brought the canes because it's just one of the many things we're looking at, but one of the things that people can use, obviously you see it all the time, are canes to kind of help with their balance, and you see many people using them, but you don't always necessarily see them using them correctly or even being measured correctly. So it's really simple, really standard. Sometimes people just need to be educated on what that is. These are the most common two we see out in the community. Your single point cane, your quad cane. And this is what most people tend to have in their home. The good thing about this one is it's adjustable. There are some hardwood canes that are not adjustable, and sometimes they are made for the length of the patient and sometimes they are not. A general rule of thumb when you are using a cane is the patient is standing straight and their arm down at their side. You want it to be right here about at the wrist. Okay, that's how you know what's a good size for them. Of course, we do vary that from patient to patient depending on the patient's posture. Sometimes patients are a little bit more over, and we'll adjust that as we see necessary. But first things first, get it measured right for the patient. Now, pros and cons of the quad cane. What I see on a day-to-day level here with the patients is that sometimes these are really just too heavy for the patient. You've got to think this patient is 70, 80, 85 maybe, and she may weigh 90 pounds, 110 pounds. A quad cane may be a little bit too hard for her to actually coordinate when she walks. So she may be walking and not even getting all 4 points on. And so that comes with either we train with that or we just suggest a different type of cane. Like a single tip cane sometimes is better than a quad tip cane. Quick tip cane if the patient is not able to really coordinate this. Your hurricane, and I've seen these in the homes, and they're actually pretty good canes. They're not too bad. They've got a little swivel on them, and these are actually designed so that they can go outside, walk outside, and they can adjust to the terrain. So that's the advantage of the hurricane. The other advantage is that it does stand up on their own, and so people love that. Now, a big thing to keep in mind when you're actually looking at the hurricane is that if you have plush carpet, it doesn't stand on plush carpet. It has to really be a solid floor. So people's carpet, they may be upset if they get it and they try to put it on the carpet, it's going to just fall. Okay, so if the carpet is not sturdy or if the floor is not level, this thing will not stand up. So that's just one thing to keep in mind there. This one's actually called the Hugo version of the quad cane. So basically it's a compact version of the quad cane. This sometimes would make more sense for certain people because the quad cane is too big, and then once again the idea is about stability, but sometimes this is not as stable as it should be. Something like this would be a little bit better for certain people.
Well, thank you very much, Stephen, for that. That's very helpful. And when you go in and evaluate all patients, you kind of make a suggestion with them, which is something we really want to make sure that our patients are aware of, is that we work with them to fit them with the best equipment possible for their needs. Is there anything else that you want to share with us?
Well, we've got a very good size outfit that's been working with us for quite a while now. We've been working with HOC for a few years. We've got a really good relationship, and we're working as a team to help take care of these people. We cover the Permian Basin pretty much.
Fantastic. Well, we really appreciate you coming on today and talking with us about canes and what you do with physical therapy, and I'm sure our patients appreciate it as well. And we look forward to seeing you back again on HOC TV with some more tips for our seniors. That's it for today's version of HOC TV. We hope to see you again soon. Thanks and have a great day.
Thank you. Thanks for having me.
Thanks.